few weeks ago, we explained how the Veterinary Feed Directive would require livestock producers to receive authorization from their vet to use medically important antibiotics in feed and water. On Wednesday, the Nebraska pork producers held their annual meeting in Lincoln, where Ron Brodersen described the coming changes for those in the pork industry. Ron is the current president of the American Association of Swine Veterinarians and practices in northeast Nebraska. We talked with Ron at the Marriott Cornhusker Hotel here in town and began by asking how the use of antibiotics in the swine industry would change with the VFD.
There are some medically important antibiotics that are going to be limited in their use after January 1st. Currently, though, most feed antibiotics are used at the discretion of the producer. And so after January 1st, most antibiotics used in feed will have to be prescribed through a veterinarian, through a product or a instrument. It's going to be called a Veterinary Feed Directive, and it will bring the veterinarian more closely involved with the usage on the farm.
Are veterinarians having to go through extra training for this VFD?
No, but through the American Association of Swine Veterinarians, which I am an officer at this time, we have programs in place to assist veterinarians to keep them up to date on what is happening and what's new.
So walk me through a scenario. Producer walks into his barn, he finds a problem, he wants to administer an antibiotic. What does he have to do?
Well, there's two aspects. One is that there are some situations for prevention that a VFD issued for a farm will be in place because they anticipate a problem, but then there's going to be emergency situations that come up where there's an urgent need, and at that time the veterinarian may have to visit the farm. If it's not a situation that they're not already familiar with, there'll have to be a farm visit, some diagnostic work, or some diagnostic evaluation to justify the use of the antibiotic, and at that time then the Veterinary Feed Directive or the prescription order will be written and issued to both the feed supplier and to the farmer, and then there'll be a documentation or a paper trail for all those types of usages.
Tell me about the accountability, the liability here and kind of the checkup of how this whole system is supposed to work.
There's added responsibility now for both the farm and the veterinarian, and as well as the feed mill, in that there will be required a veterinary client-patient relationship where the veterinarian is familiar with the farm and the health program of the farm. And so there's some responsibility for the veterinarian to know what's going on before he can write that VFD, but at the same time there's responsibility, more responsibility for the farmer or the producer or the hog grower to follow the directions that are on that feed directive.
What do you think producers need to be doing now to prepare themselves for January 1st?
The first thing would be talk to their veterinarian, make sure that they have a veterinarian involved, and so that there's some communication so that things are in place before January 1st through communicating with the veterinarian, and so that the veterinarian knows which feed mill to work with for that producer.
To learn more about the background of the Veterinary Feed Directive, you can view our interview with Kansas State University's Mike Apley from the January 29th episode of Market Journal. It can be found on our website.